Hi, my name is Dr. Kiri Tapuzian, and you're watching How to Treat Intelligently. Today we're going to talk about a screening test for cancer. And every 2 or 3 years, I'll perform this test on myself. And there's a couple of companies that we use, labs. One is called Galleri, and the other one is RGCC. Galleri is in the United States. RGCC is located in Switzerland and Greece. So what this test does is it's a blood test, screening test, and it looks for circulating tumor cells that are in your blood. Yes, believe it or not, there are tests out there that will do this. So why would you want to do a test like this? Well, it's like early screening for any type of cancer. It's just like you go get a bone density to make sure you don't have osteopenia, osteoporosis. You go get a calcium score to make sure that you don't have buildup of calcium, hardening of your arteries for your heart. You go see the dermatologist to do a full body scan on you to make sure you don't have skin cancer once a year or once every 2 years. Or mammogram, thermogram if you are checking for breast cancer. This is like a screening test that you can do to see if you have any circulating tumor cells, stem cells actually, circulating tumor stem cells in your blood. And again, you would do this because if you do have any cells, you're catching it pretty early. It's better to catch a cancer earlier than all of a sudden one day they're like, oh, you got stage 4 cancer, you've got 6 months to live. Okay. The hard part is that, the stress of doing the test. And by the way, insurance doesn't cover it. And it runs like somewhere around $800 to do the test, which is, I know, it's a lot of money, but you got to get your head around it and do the test. And when I do the test, it's kind of stressful at first. It's like, oh my God, what if it's positive? What am I going to do? But you can't think like that. You've got to you go for it, you do the test. And I just had it done again about a week ago, and it came back normal. And you feel great afterwards because it's like, okay, I'm good for another 2-3 years, maybe longer. Keep doing what I'm doing, eating healthy, take your supplements, low stress, workout, So I'll put some links down in the notes so that you can read about these 2 different labs and the tests they do. And you don't need to come see me to do something like this. Any healthcare practitioner can order these. It's a great test. Look into it. My name's Dr. Kiri Tapuzian, and you've been watching How to Treat Intelligently. Take care of yourself.